Welcome to this insightful discussion on the new lung cancer screening guidelines recently updated by the American Cancer Society. The American Cancer Society, a key player in the battle against cancer, has made an important shift in its approach to lung cancer screening, a move that could potentially impact over 5 million additional adults in the United States who have a history of smoking. What's behind this significant change? The answer lies in the evidences gathered from the Nelson trial. This landmark study demonstrated that low-dose CT scanners can significantly reduce lung cancer mortality for current and former smokers. This evidence forms the cornerstone of the updated guidelines. Previously, the guidelines recommended lung cancer screening for individuals between the ages of 55 and 74 with a 30-pack per year smoking history. However, the new guidelines do away with the years since quit criteria, encouraging screening regardless of when a person stopped smoking. This significant shift in policy aims to reduce the number of lung cancer deaths, a statistic where lung cancer unfortunately leads. Lung cancer screening is crucial as it can diagnose lung cancer at early stages before symptoms develop. This early detection improves outcomes and significantly increases the chances of a cure. However, it's important to note that the American Cancer Society does not recommend screening for adults under 50 or those with less than a 20-pack year smoking history. Those who have never smoked are also not recommended for screening, although certain high-risk groups may be considered in the future. The bottom line is that lung cancer screening with low-dose CT scans is highly effective and can save lives by detecting cancers early. If you're over 50 and have a history of smoking or have been exposed to secondhand smoke or other risk factors, it's time to have a conversation with your healthcare provider about getting screened. This update has the potential to reduce lung cancer deaths significantly, a leading cause of cancer deaths in the US. Early detection is the key to combating lung cancer. Let's delve into why. In the world of health and wellness, we often hear the adage, "An ounce of prevention is worth a pound of cure." This statement rings particularly true when it comes to lung cancer. The disease is a silent killer, often showing no symptoms until it has advanced substantially. This is precisely why early detection is so critical. Screening allows for the identification of lung cancer in its initial stages before any physical symptoms have even had a chance to develop. This early stage is when the disease is most susceptible to treatment, and therefore when the chances of a successful outcome are at their highest. Imagine lung cancer as a covert enemy infiltrating your body. The sooner we can identify this invader, the quicker we can mobilize our defenses and launch a counterattack. If we wait until the enemy has established a stronghold, that is, when symptoms have become noticeable, our battle becomes much more difficult. Think of early detection as a form of empowerment. It gives us the upper hand against a formidable opponent. It allows us to take proactive steps towards our health rather than reactive ones. It provides us with the tools we need to fight back, rather than leaving us scrambling in the aftermath of a late-stage diagnosis. Science has shown us that early detection significantly improves outcomes. When lung cancer is caught in the early stages, the survival rate is substantially higher than when it is diagnosed at a later stage. This is not merely a matter of months, but often years of life that can be preserved through early detection and treatment. So, while the idea of undergoing a screening might be daunting, it's key to remember what's at stake. This isn't just about staving off a disease, it's about preserving life, about ensuring that we have as many tomorrows as possible. Remember, prevention is better than cure, and early detection is a key part of prevention. So, who exactly is eligible for this screening according to the updated guidelines? Well, the American Cancer Society has broadened its horizons with its latest lung cancer screening guidelines. The eligibility for screening is no longer confined to those between the ages of 55 and 74 with a 30-pack per year smoking history. The updated guidelines have done away with the years since quit criteria, which means that it doesn't matter when you kick the habit, you're still eligible for screening. This is a significant change because it means that more people than ever before can get screened for lung cancer. It's an open invitation to all individuals over the age of 50 who smoke or have a history of smoking. The goal here is to catch lung cancer at its early stages, before symptoms develop, to improve outcomes and increase the chances of a cure. So, if you're over 50 and you've smoked or used to smoke, you're encouraged to get screened. And it's not just about you. If you've been exposed to secondhand smoke or have other risk factors, you should also consider getting screened. It's a proactive step, a way to stay ahead of the game. The new guidelines are a game changer, extending a lifeline to more than 5 million additional US adults who smoke or previously smoked. It's an inclusive approach, recognizing that lung cancer does not discriminate based on when you quit smoking. These updated guidelines are not just about broadening the eligibility criteria, they're about reducing the impact of lung cancer, the leading cause of cancer death in the US. It's about saving lives, about giving people a fighting chance against this formidable foe. So if you fit the eligibility criteria, if you're over 50 and you smoke or used to smoke, don't hesitate. Talk to your healthcare provider about getting screened. These guidelines are an important step towards reducing the impact of lung cancer. Despite the expanded eligibility, there are still some who are not recommended for screening. Let's understand why. The American Cancer Society's new guidelines, while inclusive of a broader demographic, still have certain restrictions. So why is screening not recommended for everyone? Let's delve into that. First, adults under 50 are not advised to undergo screening. This is primarily because lung cancer, though not exclusive to older adults, is far more prevalent in this age group. The risk of developing lung cancer increases with age, particularly for those over 50. Thus, the benefit of screening for younger adults does not outweigh the potential risks, such as radiation exposure and the possibility of false positives leading to unnecessary procedures. Next, there's the 20-pack year smoking history criterion. What this means is that if you've smoked less than 20 packs of cigarettes a year, screening is not recommended. This is based on the correlation between the amount of smoking and the risk of developing lung cancer. A lower level of smoking equates to a lower risk of lung cancer, making the screening less beneficial for this group. And what about those who have never smoked? While it's true that non-smokers can develop lung cancer, the risk is significantly lower compared to smokers. The primary risk factors for lung cancer, including tobacco smoke and exposure to certain chemicals, are absent in non-smokers. Therefore, routine screening is not generally recommended for this group. However, it's worth noting that certain high-risk groups, such as those with a family history of lung cancer or exposure to secondhand smoke, may be considered for screening in the future. It's also important to remember that screening is not a substitute for quitting smoking. The most effective way to reduce the risk of lung cancer is to never start smoking or to quit if you currently smoke. While screening is a powerful tool, it's not for everyone. It's crucial to discuss with your healthcare provider to make an informed decision. Let's talk about the technology that makes this all possible: low-dose CT scans. This technology is nothing short of revolutionary, and it's playing a pivotal role in the fight against lung cancer. But what exactly is a low-dose CT scan, you might ask? Well, it's a type of computed tomography scan that uses less radiation compared to a standard CT scan, making it a safer alternative for regular screenings. Now let's delve into how this technology works. Imagine a series of X-ray images taken from different angles around your body. These images are then processed by a computer to produce cross-sectional images or slices of the bones, blood vessels, and soft tissues inside your body. This detailed view allows doctors to detect lung cancer at an early stage, often before symptoms even begin to surface. But it's not just about detecting cancer, it's about doing it effectively and accurately. This is where the Nelson trial comes into play. This large-scale clinical trial showed that low-dose CT scans could significantly reduce lung cancer mortality for current and former smokers. The trial concluded that the scans are highly effective in detecting lung cancer early, thereby increasing the chances of successful treatment and survival. It's important to mention that while these scans are highly effective, they are not without their limitations. For instance, they can sometimes lead to false positive results, causing unnecessary anxiety and further testing. However, the benefits far outweigh the risks, especially for those at high risk of developing lung cancer. So, let's take a moment to appreciate this incredible piece of technology. Low-dose CT scans are not just another medical advancement, they are a beacon of hope for millions of people who are at risk for lung cancer. They are the key to early detection, the cornerstone of successful treatment. And most importantly, they are the tool that can help reduce the number of lung cancer deaths. With the help of low-dose CT scans, we can save lives by detecting cancers early. We've covered a lot of ground, but you might still have questions. Let's tackle some common ones. First up, let's clarify what we mean by a 20-pack year smoking history. This term is a way to measure the amount a person has smoked over a long period of time. It's calculated by multiplying the number of packs of cigarettes smoked per day by the number of years the person has smoked. So, for instance, if you've smoked a pack a day for 20 years, or 2 packs a day for 10 years, both would be considered a 20-pack year smoking history. Now you might be wondering, how often should I get screened? The American Cancer Society recommends annual screening for lung cancer for individuals who fall into the high-risk category. That means if you're over 50 and have a 20-pack year smoking history or more, you should be getting screened every year. Next, let's talk about the risks associated with screening. While low-dose CT scans are an effective tool for early detection of lung cancer like any medical procedure, they carry some risks. The most significant risk is radiation exposure. Although the amount of radiation in a low-dose CT scan is small, repeated scans over time can lead to a slightly increased risk of cancer. Additionally, these scans can sometimes lead to false positives, causing unnecessary stress and additional testing. But don't let this dissuade you. It's important to remember that the benefits of early detection often outweigh these risks, particularly for those at high risk of lung cancer. Your next question might be, how accurate are these low-dose CT scans? These scans are remarkably accurate. They can detect very small nodules or other abnormalities in the lungs that might not be visible with a regular X-ray. However, while they are excellent at detecting abnormalities, they can't determine on their own whether these are cancerous. Further testing is often required to confirm a diagnosis. In conclusion, if you're over 50 and you have a 20-pack year smoking history or more, or if you're exposed to secondhand smoke or other risk factors, it's worth discussing lung cancer screening with your healthcare provider. Remember, knowledge is power. Stay informed and proactive about your health.